Right, so thank you very much, and hi everyone. It's really an honor for me to be a part of this conversation on climate change and health. So my name is Charlotte Mbuh. I am a deputy director at the Geneva Learning Foundation, and I am based in Cameroon. And today I'm going to be sharing with you a report from frontline health workers talking about sharing their observations on the impact of climate change and health. Next slide, please. So the Geneva Learning Foundation, we are a Swiss nonprofit with a mission to research, develop, and scale up new ways to learn and lead against critical threats to our societies, like what we are looking at today, that's the impact of climate change and on health. So to achieve this, we developed a unique approach to grow and nurture digital networks. So our participatory bottom-up approach, which is very much different from the traditional or formal academic research, seeks to empower frontline health practitioners, considering them as knowledge producers and change agents, fostering context-specific solutions to the challenges that they are facing. So we are a purely digital network that reaches over 50,000 health practitioners in over 100 countries. And so on the 28th of July, 2023, we facilitated 2 digital events in English and in French, during which health workers shared observations and discussed changes in climate and the environment and their impacts on the well-being of the communities that they serve. So today, right now, I'll be sharing with you how we engaged about 4,700 health practitioners and what we were able to learn from them. Next slide, please. So we reached out to these health workers that are part of our peer learning platform and also across social media. And we asked them one question: is climate change a threat to the health of those you serve? And then why? So when they were registering for the event, we invited them to answer a series of questions relating to the changes in their local climate and impacts on the community health using a standard questionnaire. Our insights unit then went ahead to do a quantitative and qualitative analysis of the data leading up to the 2 online peer learning events that I mentioned earlier. Next slide, please. So who did we reach? We were able to engage 4,700 health practitioners from 68 countries who registered for the event, and they submitted 1,260 observations. So 56% of them were frontline health workers from the district and health facility level. Those are the operational levels of the health system, as you can see on the chart on the pies. On your screen, and 81% were reported to be closely related to the communities that they serve. They were either considered to be part of the family or a trusted friend of the community, and 54% of the respondents said they were working for the government, that is the Ministry of Health in their countries. So this is really to zoom in on the fact that health workers, frontline health workers, could potentially be trusted advisors to the communities that they serve. So next slide, please. What did we? So respondents were highly concerned about climate change, and most of them reported a strong sense that climate change is a threat to health. So as you can see, I just want to share with you 2 observations that were reported, one by a woman named Liliane from Cameroon, and the second one, a man, Joseph, from a health facility in Kenya. So Lilian, she said, where I live in Mbuh, the flood from Mount Cameroon took away all belongings of people in my neighborhood and killed a secondary school student who was playing football with his friends. Joseph said, due to climate and weather changes, food production has declined. There has been job loss, low income and depression. Also, men became alcoholics, which is now a national menace the government of Kenya is trying to fight. And I think this is also, most of the observations also agree with what Dr. Leitai presented earlier on the impacts of climate change on health in Vietnam. So we saw that 93% of respondents believed that there was a link between climate change and health. And they reported a direct local experience of a wide range of climatic and environmental impacts. From a list of 20 potential impacts, the three that were most commonly selected were the impacts on farming and farmland, the impacts on the distribution of disease-carrying insects, and urban areas becoming hotter. So across this group, 13 out of the 20 impacts were reported by 25% of the respondents, illustrating a wide range of effects linked to climate change being noticed at the community level. So in terms of the health impacts that were commonly reported, presented with a list of 17 potential health impacts, the health impacts that were most commonly reported and that are linked to the climatic and environmental impacts I listed before were increased malnutrition and or undernutrition, increased waterborne diseases, and changes to the incidence and distribution of vector-borne disease. And you can see the percentages that are there. So what we also observed was that most of the observations were from localized. Please, can you go back to the slide? Where most smaller communities or mid-sized towns. So 234 observations, that's approximately 20%, represented populations in small communities of less than 20,000 people. So highlighting the prevalence in small towns or villages. And then about 380 observations, that's roughly 33%, were for populations that were had under 100,000 inhabitants. So next slide.
Yes, yeah.
Thank you. So after, looking at these observations and during our two events interacting with frontline health workers, we realized that climate change is having significant and localized impacts on the health and livelihoods of particularly vulnerable communities. I don't think that is new. There are so many papers that have been written around that. But what we wanted to showcase here is that frontline health workers are trusted advisors of the communities that they serve, and they have unique insights to local realities and are strategically positioned to bring about change. Without being prompted or supported by anyone, many of them reported that they were already taking initiatives at addressing and mitigating the impact of climate change on the health of their communities. With this in mind, we believe that improving the knowledge and context-informed communication skills of frontline health workers, we can also improve community knowledge, attitudes, and responses to the impact of climate change and health. To achieve this, we aim to leverage our digitally enabled peer learning network of health workers in over 60 countries to surface more local insights and drive change across different levels of the health system. That is from the local to the national to the global level, and also across geographical boundaries. That's across countries, across regions of the world, you name it. So through facilitated knowledge exchange and collaborative sense making, our methodology can build health workers' capacity for effective climate action that can hopefully translate to policy change at all levels, because we think the most difficult part is usually being able to lead to policy change, starting from not on a traditional top-down approach, but from the bottom up. I would like to just conclude by reading this quote from one of the participants in our event, who said, it's Dr. Chinedu Anthony from a health facility in Nigeria, who said, "This experience highlights the challenges faced by rural communities in Nigeria due to climate change. It demonstrates the importance of community engagement, sustainable practices, and support from relevant stakeholders in addressing the climate health nexus and building resilience in the face of a changing climate. Next slide. I just want to acknowledge all of those who supported us in doing this work and developing this report. And you can see in the chat, there are some links where you can download the report that we shared. So before closing, I would like to tell you a little bit about a networking event that we'll be organizing in June this year. Next slide, please.
Yes.
Okay, that event is Teach to Reach, and it's the 10th edition that will have a particular focus on climate change. So building on what we have learned so far and on our participation at COP28, we would like to continue to give voice to health workers on the front lines to highlight the urgent need to invest in health workers at a local level to build resilience for climate change. So we'll share the link in the chat. The link is already there. Thanks, Reda, where you can have more information concerning Teach to Reach, which is a networking event that reaches thousands of health workers on the front line who work in remote rural areas with urban poor in the most affected communities that we may think about or talk of when we are talking about climate change. So looking forward to your questions. Thank you very much. Next slide. Thank you.
Thank you, Charlotte, for giving us this introduction from your perspective. Very interesting from the side of that Geneva Learning Foundation. I made a copy of all of your links, what you were like putting into the chat in case that people couldn't get all of it. So we can also share it with that participants later on. As the colleagues would like to continue with the session B already shortly, I would also here like to skip that question and answers. Please address your questions to Charles